to another exclusive session of Dr. Kamini Rao's masterclass.
That the best way to serve the people when they are in a crisis, if we help them, they remember us, because many of the nurses are happen to be the female nurses. They don't get an opportunity to read the magazines.
Like what we have in the NMC, is there going to be any kind of an NC?
Facilitated my nursing graduates, the employability in the government sector in the rural area is going to increase. So we have brought back that course to India. So all the nurses we have developed with great difficulty, because see, we have to work as a team in the healthcare delivery system. So medical fraternity has to accept us as one of the specialists. So therefore, the Indian Nursing Council developed the nurse practitioner critical care, a residency program, not like going to the classroom. They have to be in the clinical setting in 24/7 for 2 years. It is just like MSc nursing in critical care. And then we took the syllabus to the ministry. Ministry had a meeting with all the stakeholders. Then they approved it. Now we have about 55 institutions are running this 2-year the MSc in critical care program. Like Manipal, after that they created a post called critical care nurse practitioner in critical care. They are given a designation. So we are repeatedly talking to these institutions, create the position. If you don't create the positions, the
Why
retention
will they have that interest to join?
So like for example, MGM Medical College in Mumbai, and also the Kharad Krishna Institute of Medical Science in Kharad. These two institutions have shown a very excelled themselves in critical care. They have all the intensivists have told us these my 10 critical care nurses are extraordinary. So they have said we can leave them, they will manage the ICU. So that type of now we have created that environment. So now we would like to have more in abroad. There is all the clinical is managed by the doctor of nursing practice, DNP. That is the new in the America. All the units are headed by the DNP. They are experts, because in academics you have PhD. That is PhD in academics. But for clinicals we have a DNP in America. So now I have Indian Nursing Council had a MOU with the University of Houston, and we are going to develop a doctor of nursing practice on a pilot basis. At least shortly we are going to start, so that my nurses can have a career path from the graduate nurse to the postgraduate in critical care, then the DNP. So that so in that perspective, that's one that level we have gone. Similarly, at least I have to give credit to the Government of India under the National Health Mission, that the Indian Nursing Council and the Ministry of Health and Family Welfare work together, and they have come out as a midwifery guidelines. You might have seen the evidence which has shown that if you train effectively the midwives on the ICM competencies, they can prevent 88% of the maternal and neonatal deaths. This is an evidence which has been brought out. Keep taking that evidence, the Ministry of Health has rolled out a midwifery guidelines, and they have said the nurse practitioner midwives has been approved now, and it is aiming to train 88,000 nurse practitioner midwives. Any graduate nurse, any diploma nurse can undergo 18 months training, specialty that training, and they will become nurse practitioner midwives. The scope of practice for midwives has been, whatever some of the procedures which you mentioned, they will be able to perform these minutes. There is a protocol is there given by the National Health Mission, so that all the normal deliveries and all will be conducted by only the gynecologist will be able to take on some specialty, because we have a shortage of the gynecologists. So this whole program of the midwifery guideline, and for the first time the Government of India has taken initiative to take care of the training and placement in the rural area midwives. That is going to give a lot of importance, because the MDG goals of attaining the maternal mortality. So therefore, these people will be able to facilitate for the reduction of the IMR and MMR. So, that course also we have already developed, and shortly we are going to roll out those nurse practitioner midwives program. So, specialty is getting more now, because the medical doctor has gone to MCH, whereas we nurses in the general nursing only in the general.
I know.
So,
So,
therefore,
they're also
we are
moving forward.
to work. If you are a specialized, you will be able to effectively participate in the team for the good impact.
Absolutely. I think I agree with you. I think we've talked a lot about the nurse practitioner, and I'm very happy that a lot of things are taking, growth silently, but nevertheless there has been some movement there. And this is what I really wanted to see, because even when I was in the UK, we always had a midwifery unit in the birthing center, and this was actually also on the notice board where the birthing was taking place, and there was separate labor wards for the midwifery unit. It's only when they had problems, then they would get in touch with us. Until such time, that was a separate unit itself, and this was going back way back in 1985, and so they had this system way back then, and we are still thinking about it now.
No, I think at least see, any change in India, any policy decisions, it takes a lot of various consultations, and at least I am happy because since I happen to be working in the Indian Nursing Home for a long time, so I have seen how some of the bottlenecks which you have to face, how to policymakers to convince them. So, at least I am happy that National Health Mission was able to take our suggestion, because we without the ministry consultation, we started the nurse practitioner midwives for 1 year program. So, now after seeing that, now whatever they have given at least policy approval, because anything in India, it requires a policy approval. Without that, no, independent, though I may be a regulator, but I may not be able to effectively implement it in the field until unless you get the blessings of the policy.
Well, I think, having spoken so much about the education part of it, but having gone beyond that, having been in the policies for so long, 3 decades to be exact, what made you stick into this thing? I mean, you have been an advisor in the past, and you've actually seen the Nirban Bhavan, through and through, and seen many of these people go through, join in and join out, and exit it also. What have been your thought processes as you've seen through the decades from say the beginning of your career in Delhi to now?
I think to stand out in the ministry, a person who is very committed, and even at 7 p.m. if a boss rings up, tomorrow is the parliament question, I need data. So, even if you are there in the chair at 7 p.m. also, and if you are able to deliver it in the morning at 9:30, so that type of a commitment, and somehow or the other, in our nursing discipline is created on the first day. We in the nursing professionals, we are more disciplined professionals compared to the other professionals. So that the discipline made me to put that. And another challenge which I took was many a times we technocrats, we always tend to take the budget is not my cup of tea. Administrator has to do the budget. So that attitude, if we have, we will not be able to successful in our career. So I learnt making the projects, working in the Nirman Bhavan. I learnt the art of preparing the project implementation committee reports. So that's how I was able to convince, when I joined as a nursing advisor in 1994, my budget for the national was only 40 lakhs. So only 40 lakhs at that time, 1994, national level. So till 10th plan, by evaluating the schemes, see, in Government of India, you can get the plan allocation. you can't spend until unless you have a sanctioned scheme. That scheme will have a different pattern. What should be the plan money? What should be the recurring? What should be the non-recurring expenditure? What should be the salary
So that
component?
envelope is there, but you can't do anything.
So therefore, I prepared a scheme has to be approved by the finance. If you don't get the approval of the finance division, you cannot roll out the scheme. So there were no schemes when I joined as a nursing advisor. So I developed the schemes, and I brought the money from 40 lakhs to 80 crores for the 10th plan. 11th plan was my nursing budget for the national level was 3,220 crores.
How did you manage that?
I was able to convince how nursing needs an investment, because we have to have, because many of the district hospitals where there is no private nursing school, we wanted to have all the districts should have one government nursing school. So that was the plan. We have to open more A&M schools, more GNM schools. We have to convert we had a talk in the ministry that the capital of India was running with a diploma program in government hospitals. So like Safdarjung Hospital, Lady Hardinge, and the Ramanoorle Hospital. These are the very top hospitals in India. Still they were running the diploma program. So I had to tell my bosses, sir, when the capital of India, when West is going so aggressively for the career path, why we should run these institutions with a diploma? So we converted these schools into colleges by investing money from the ministry's funds, and also all the All India Institute of Medical Sciences, the new aims which were coming up, they were not having a nursing college attached to the aims. So nursing budget only gave at that time 125 crore from my nursing budget to all the 6 All India Institute of Medical Science at the rate of 25 crores per each aims. That's how now you find all the aims will have attached nursing college. So so if you have a committed, somehow I felt, even now I feel my bread and butter was nursing. So I have to give it back to nursing.
What about the jam?
The jam has to be there.
The specialities.
Specialities. So even now, still I find still lot of to be done for nursing. Though we have gone, I fully agree with quality of nursing education is more concerned. That's how we are putting more focus on the quality. This National Nursing Midwifery Commission, which is coming up, will have an entrance examination, will have exit examination, all these issues which we have been focused in that. So, and another important thing which we are now focusing about the 2020 is the International Year of the Nurse Midwife. The whole globe is celebrating the 200-year birth anniversary of the Florence Nightingale. So the WHO, for the first time, they have declared 2020 as an International Year of the Nurse and Midwife, which is a great thing. Our International Council for Nurses took up this issue. One Lord Nigel Crisp from the UK, he was happened to be the ex-NHS Health Secretary of there. He is retired now with Lord Nigel Crisp, and he took the initiative of how to celebrate 200 years birth anniversary for Florence Nightingale. How she made that time statistics was introduced in the hospital at that time. How infection control can reduce the mortality of the soldiers at that time. So such a lady who is a founder of the nursing, for modern nursing in the globe. So they took this issue to the International Council for Nurses and also to the WHO, that address now the present DG. He really said, if we have to achieve the MDG goals, without nurses you cannot achieve the universal health coverage. That is his statement. Without nurses you cannot achieve the universal health coverage.
Absolutely.
So therefore he declared the 2020, but due to pandemic nobody could not celebrate
That's what they made it
this thing.
2021.
But this COVID-19 has given a lot of visibility of the nurses among the eyes of the public,
Yes.
because now everybody knows nurse is so important in COVID-19.
Absolutely.
Because so this campaign is going on in this thing. So the WHO has also brought out the State of the World Nursing Report. The State of the World Nursing Report, first time they have brought out State of the World Nursing Report, and also the International Confederation of Midwives also brought out the State of the World Midwifery Report. So all these two reports the WHO has studied. The main theme of these reports are, investment in nursing education. They are telling to the globe, after doing the evidence, global evidence, they are telling each country should invest more money for the nursing. Number 2, creation of the nursing position. Number 3, leadership. So there are 10 recommendations are there in the State of the World Nursing Report, but main theme is these three aims. So in these, similarly, they have projected 6 lakh the nurses are shortfall by 2030. But whereas ICN, by taking many of the, during COVID-19, lot of nurses invest, and in different parts of the world, they are going away with the nursing profession. And also the aging is also one of the factors they have considered. So they have said about 13 million the shortfall of nurses globally by 2030. So therefore, there is a need to invest more and give more importance for the specialization and improve the working conditions, and how to take some measures to attract the young girls to get into nursing. After the nursing training, how to retain them.
That is the most important.
That is the most. All these things have come in the report.
They've come
Now,
in
this 28th May of 2021, the World Health Assembly has passed a resolution called SDNM 2125. SDNM means Strategic Direction for Nursing and Midwifery 2125. Their cycle, 4-year cycle, the World Health Organization follows. So this resolution has come to now India. Means it has gone to all the countries. All this strategy, which has been reflected in that State of the World Nursing Report, now it is a challenge for our nursing and midwifery professionals, and also to the Ministry of Health policy makers, how these recommendations to get it translated into action. With a focus, if they are able to implement these recommendations, there will be a strengthening of the health system, the overall, because the large number of the 2/3 of the health workforce is happen to be the nurses in any health system. Absolutely. So therefore, the strengthening and training and quality, all these issues can be addressed. So this is the opportunity for my nursing and midwifery professionals of India. I am telling my nurses, this is a lifetime opportunity. We have got it. We have to see that how it should be get it translated for implementation.
Absolutely. So having said so much, and I think that there is an old saying that when times are difficult, remind yourself that there is no pain and it comes to you without a purpose. You have to tell yourself, has there been any time that when you've had such an incident in your life where you doubted that for what purpose have you taken nursing, and there has been so much of pain, you've not been able to achieve something, and you've looked at your family's support, because obviously being in a position for 3 decades, you would have had so much of ups and downs.
I have a good partner, life support, where they said my missus happened to be a nurse. She was also happened to be a nurse. But of course, after going to Delhi, we were batchmates in Karnataka. So she also worked in government of Karnataka for 6 years. I also worked for 6 years in Karnataka before moving into Delhi. But after going into Delhi, my son was 3 months old, because of the language, weather, and also many practical problems. She left the job, and she is the sole supporter to me to take on these challenges in Delhi.
So any instances that you can think of that she became such a support for you, because obviously being in a government service, you would have your highs and lows, and the politics.
I had a lot of problems many a times. For example, nursing was not getting much support. For example, we give a President Award to all the outstanding nursing professionals. And when Abdul Kalam was the President of India, so he sent a message to our Health Secretary that you are giving a cash prize of 5,000 rupees for each outstanding nurse. So why are you, this is the peanuts, this is the word, it was communicated to my secretary. My secretary was further called me and told, put up the file for increase the award and the money. So while working in a government system, you have to have some evidence to increase it, otherwise no, finance will not agree. I just took the Ministry of HRD's circular where the teachers were given 50,000 rupees was the award, cash prize. So I took that order and placed it in the file, made a noting and sent it to my boss. So that boss was very angry and almost he said, you change how can you work in a government system, increase for 10 times? You can increase 2 times, 3 times. How can you? I said, sir, this is for teachers if they are getting, we should have some analogy. No, reduce it. I said, sir, I will not reduce from my pen, you can reduce from your pen, I said. So then the insubordination case was instituted because not taking the orders of boss. So, so ultimately, the bigger boss came to my rescue. That what is. So he said, the finance will not agree. Sir, you send it to the finance. If they did not agree, no problem. So my note was not any correction within 48 hours. The note was approved by the finance division.
Which was such a success.
So afterwards, I faced a lot of turmoil with my boss and so many vigilance case against me. And once you work in a government, sometimes you may not be able to take the orders what they are telling. So I faced a lot of such instances. But my aim was that somehow with my experience, I could withstand a lot of my colleagues, bureaucrats especially. They used to come to my help and they saw my sincerity in my work. So they used to help me, and a lot of help I got from home, family, and unitary family in Delhi. How in Karnataka population in Delhi is very less. You don't have much, so still we were able to manage. But I am very happy. At least I was able. That's what I repeatedly tell. Bread and butter for me is the nursing.
Yes,
you have to give it back to nursing. So
yes, absolutely. No, but what I actually feel is, unless you do a lot, I mean, recently there have been some controversies that come in. Obviously, with being in this kind of a profession for 3 decades, there will always be something or the other keep cropping up here and there. And that is the reason I always thought, you really have to be, with an iron fist and iron heart and an iron brain to face all these things and just to push them aside. So how do you manage to face controversies in the public?
I think once we position in the top positions, definitely
there'll always be.
There will be. It is difficult to satisfy all the categories, but still, for example, in my committee in the Indian Nursing Council is the only regulatory body where we have 3 member of parliaments. Like medical commission, they don't have MPs, but we have in our council 2 members from the Lok Sabha and 1 from Rajya Sabha. So we have 3 member of parliaments. I have all that. Out of 3, 2 will be my executive committee. So once you are there in executive committee, I have monthly meetings are happening. The day-to-day work, how we transact, is put up to the executive committee. So in crisis, they always came to my help because, like for example, we new building we purchased from the NBCC, National Building Construction Corporation. So we were not having a good space in Indian Nursing Council. Now we have a beautiful building, like a corporate office we have in Delhi. So many people complained that there is a scam of 48 crores in that purchase of the building. So ultimately, all the investigation was held, and they found that How can Indian Nursing Council from government check is going to the another government office check? It is NBCC, is a Navratna of the government of India, is one of the Navratna. So see, that is the jealousy. As you rightly said, many people are not because after seeing that building, they would like to come and sit in the new building. So I said, no problem, but as long as I have a support from my nursing fraternity, few people they will be definitely they will not be happy. So at least my nursing community experts, see, my working with my experts, I am able to excel in that council, because all my curriculum framing, I have a very good experts like CMC Vellore. They are my core experts. So any like nurse practitioner critical care, when I prepared the curriculum, the one of the Professor Mehta, I have not seen Mehta, cardiothoracic surgeon from UK. He sent a mail to Ministry of Health. The syllabus which is prepared by this council is similar to the nurse practitioner in UK. So it should be implemented. So that is a
Absolutely.
so
Pat
we,
on the
we
back.
means we go with a very good sound experts. So I have at least those experts are with me, and when the people are major nursing community is with me, because they see the how I am taking some policy decisions, which is facilitating for the growth of the nursing sector. My each day I am only thinking how best my nursing sector should get a priority.
In fact, I must tell you, Dr. Dileep, that I also wrote a book on nursing and midwifery. And because most of the books are either on nursing or on midwifery, but I combined the two and did a book, both including nursing and midwifery, by Elsevier's. And it did reasonably well, because other than that, I've written 50 textbooks. And I felt very nice doing it, because this was on midwifery and basic nursing. And I told myself, if ever I had to do, that was the only book I did on nursing and midwifery. And then when you were coming and I said, oh, this is nice, I'm going to ask Dileep how much he does about the education, and what you spoke to me about the nurse practitioner really gladdened my heart, because I'm a die-hard educationist in this regard, and that is why I wanted you on this show. And what you've given me as an experience, an educationist will always be happy with the education, and that's why, believe me, being from Karnataka and staying in this profession for 3 decades is not easy. And now with the NNC coming up, what are the chances of you being in that?
No, because it will have a new format. Totally, it will be a new format. We have to see, because my age may not be in my favor to get into that new
No,
format.
but age is only a number, okay? They ask you to take it as a caretaker for some time till everyone gets used to it, isn't
No
it?
problem. But my only thing is I am at least living some of the systems which I have put in place.
A legacy.
Systems are put like the nurse practitioners specialization, the NRTS nurse registration tracking system, which is going to be one of the because reliable data is very important for a manpower planning, which is not there now. So that's why I feel so happy that once you have a reliable data, the future planning becomes easier, and the nurse practitioners and the new building, which is everybody when they come to my new building, they are all very happy to see the corporate style of
Good.
building.
Very nice.
So I want to change the mindset for the people who gets into my building. Oh, nurses also can have this type of a building. That's my.
What do you mean? With 200 years of Florence Nightingale, I'm sure.
But the attitudes still we have to work very hard. I think it should not become only platform speech. It should become a convincing,
It should
because
be a
our
reality.
reality. See, our nursing organization at the national level, at the state level is very weak. So I have to ask as a nursing advisor, the then Prasanna Kumar Hota is the health secretary. He wrote a devo letter to all health secretaries the nursing organization from the national level to sub-center should be strengthened.
More than strengthen, it should be empowered.
That's the problem. That is my always we are working for that. How best we should strengthen, put the nursing leaders positions in place where there is there. Only good nursing organization I can see in my India is the West Bengal.
They're good.
So there are about 70 nursing officers are working at the directorate. That means even pension of the nurses, that section will be having. Means all nursing issues in one section, where 70 nursing officers are manning that. So the recruitment rules, working conditions, which is not there. Many of the policymakers went and saw, but they say is very happy, but when they come back, they don't put the same support to the nursing. That is one of the problems we have to address it.
That was an amazing session with you, Dr. Dileep. And I believe my viewers would love to hear from you. What is the kind of message that you would like to give my viewers? Because you have been always saying that the nurses should be empowered, they should be seen the kind of work they were doing, because Florence Nightingale has been around now for about 200 years and we still do not respect and empower nurses like they should be. They should be pedestalized. So what do you think that the nurses should be given their pride of place? So how do you want to give the viewers, what is the message of what we have actually spoken across to them?
My message to strengthen the nursing and midwifery in India and to have an impact in the health system, so that there are evidences globally available that having more nurses, the mortality rate and the length of a stay in the hospital will be reduced, and the post-operative complications will be reduced. All these evidences are available, but there is a need to put it to action in India. For example, our nursing organization at the national level and the state level has to be strengthened, and we have to, as per the status of the World Nursing Report, the theme of these three, that means investment for the nursing education, has to be given more priority, and also creation of the nursing positions. The creation in the sense, it means at least no optimum nurse patient ratio has to be maintained, and also the optimum nurse patient ratio not only in the general ward or the special ward, in the critical care, in the ICUs, in the OT, in the OBG, all these neonatal. So the optimum nurse patient ratio has to be implemented, and the working conditions of the nursing and midwifery professionals needs to be improved, because there is a latest Government of India's Supreme Court guideline has been issued to all the state governments that the minimum pay scales has to be given to the nursing and midwives, because this is Supreme Court guided circular has been issued by the Ministry of Health and Family. This need to be implemented. This will facilitate for attracting the young girls to get into nursing, and also it will facilitate for retention of the nurses in the health sector. That's because our health system in this COVID-19, we could have seen how best having more nurses and midwives. Our nursing and midwifery professionals in this COVID-19, they have taken the responsibility and worked very hard, and whole the government and the public has appreciated their role as a nursing warriors in the healthcare delivery system. So therefore, it is an opportunity and it is a challenge for the nursing and midwifery profession to take this challenge and to see that our aim should be to provide qualitative nursing and midwifery services to the public, with the ultimate objective of reducing the maternal and infant mortality rate and hospital acquired infection. So therefore, our role is going to be very significant in the healthcare delivery system.
That was fantastic, Dr. Dileep Kumar. It's such a pleasure to have you here, flown all the way from Delhi to be on our show. That's very, very kind of you, and it has always been a pleasure having you here. Being in the Nursing Council as a president for 3 decades in itself is a masterpiece, and having brought so much of change there, what with the census for the nurses, which is so important, documentation, and to have a good corporate office for the nurses, it's fantastic. Believe me, there can be no healthcare without the nurses, because doctors come in and have a look at the patients, yes, but it is the nurses who are empathic with the patients, who are there 24/7. And I think they are the unsung heroes, be it COVID or non-COVID, or be it in the hospitals itself. They are the real residents of the hospital, and I think they are not been given their rightful place. And having you here perhaps will again give that kind of impetus to this masterclass to say nurses are an important tripod of care along with our junior doctors, our consultants, and the other healthcare workers. So thank you very much for coming, Dr. Dileep Kumar. So my dear friends, thank you for watching Dr. Kamini Rao's masterclass. Till I see you again with the next episode. See you soon.